Cases of what some today would say are anorexia surfaced in the 1300s with Catherine of Siena. Women of the 14th century up until the 19th century were thought to be the epitome of feminine holiness when they survived without food. They survived on prayer and God. Food was not needed to sustain life. With religious ideation comes skepticism. This is just what holy fasting women underwent. Women who professed God's grace through self-starvation came under fire with questions of authenticity, ranging from demon possession or fairies to witchcraft or just plain insanity. In the 16th century, the falsehood of God's grace through fasting was punishable by death, as with the case in Germany when a young woman was found to eat in secret after claims of deprivation. From fasting for God came a new wave of distorted eating. Spiritualism sprang forth in the United States at the latter part of the 19th century. Now it was not God who took over hunger's powerful grip, but spirits or the dead who could be contacted through these young women. A change began to take place toward the end of the 19th century. This change moved from religion and spirits to the more sensible explanation of medical disease or nervous disorders. Patients with anorexia do not see the stick figures they have become. Instead, they see grotesque images and flaws of extra weight and fat. Anorexics' distorted view of themselves is so skewed that even a cracker having less than 50 calories gives great distress to the patient, since they believe that they will gain weight and become fat with a minute morsel of food. Bulimics also have skewed views on body image and food, which is why they engage in compensatory behaviors after binges to prevent themselves from gaining weight. These behaviors may include vomiting, using laxatives, diuretics, enemas, or medications inappropriately. With images and media portraying beautiful thin women, it's no wonder that adolescent girls are at a high risk for eating disorders, but they are not the only population or age group susceptible to disordered thinking. Eating disorders do not discriminate against age, race, or even sex. Eating disorders were once thought to only affect Caucasian girls, but African American women are no longer protected as once was thought. Boys and girls in grades 5 through 8, or ages approximately 9 to 15, reported that they had felt fat and or wanted to lose weight. Behaviors reported used in an attempt to gain control over their bodies were diet pills and diuretic use, dieting, fasting, and vomiting. It's easy to automatically point the finger of blame at the fashion industry or at the media, but there is more to the picture of what causes eating disorders than weight loss ads and stick figure models. But just because there is a presence of food at every corner with a newsstand of ungodly tiny women on magazines to accompany them, it does not mean that the influence of one or both will cause an eating disorder or cause someone to develop one. Looking at a popular American icon may shed some light onto the subject. Barbie has changed since her debut in 1959. She is now more anatomically correct, but this change was only implemented at the beginning of the 21st century. It's unrealistic to pin all of the blame on a plastic doll, but that doesn't mean that her plastic charm didn't have an effect on her 4 to 10-year-old target audience. In 1965, Mattel, manufacturer of Barbie, created Slumber Party Barbie. She went to her friend's house with her luxurious pink robe, a set of curlers of course, a scale set to 110 pounds, and a diet book. The tiny diet book read, "How to Lose Weight," and gave the most obvious tip on the back: don't eat. Personal experiences have profound effects on our internal processing. This is true with eating disorders as well. Eating disorders are often linked with abuse, teasing, and trauma. Eating disorder sufferers choose to focus on eating or binging as a way to cope with these emotions. Rejection can lower self-esteem, turning normal eating behaviors into unhealthy behaviors. Other internal risk factors are of the cognitive nature. Obsessive thoughts of food, weight, shape, and others' perceptions of themselves affect a person with an eating disorder. Patients with eating disorders spend from 3 hours a day on these thoughts, while other patients spend more than 8 hours a day obsessing. There are many aspects of eating disorders that need to be addressed when treatment takes place other than correcting disordered eating behaviors. The first thing that needs to happen in regards to treatment is getting the patient physically healthy. With anorexia, there is a risk of low weight that needs to return within normal range. Treatment therapies that have shown to be effective are behavior modification, CBT, family therapy, and dynamic therapy. Psychoactive medications can also be combined with therapy. Throughout treatment, patients use food journals, self-monitoring, problem-solving exercises, and creative outlets to help them overcome their disorders.